Arthur Lowry, CEO here at Amazing Care Home Health Services. Wanted to put together a video for our patients to help address any concerns you have about receiving care during this COVID-19 pandemic and give you some insight to what we're doing to ensure your safety. First, I'd like to discuss, we're following the CDC, Colorado Health Department's protocols, procedures, and recommendations. And we're utilizing PPE, which is the protective gear that our employees are wearing now, to make sure we stop the spread of any kind of transmission of COVID-19. So you may see your clients all garbed up, and that's meant to protect you. So we've issued, or at least released, N95 masks. Those are available to all our staff if they need to use it. So keep that in mind, that if your staff comes in with a pretty robust looking mask, don't be afraid. It just means that we're ensuring your safety and their safety. So it's important to note that we'll continue gaining access to PPE. I know that there's been a lot of talk about limited access to it. And so we're working with Catherine, who's our administrator, to obtain and acquire as much PPE as we can to ensure your safety. So with that in mind, a couple other things to note: that we don't currently have any clients receiving care from any of our providers that has active COVID-19. So I know there's a lot of worry about when your clinician comes in, have they been in a home where the patient may have been receiving care who's known to be COVID-19 active. We don't currently have any of those. Obviously, testing is going on, and if we do end up with an active COVID-19 client, what we're going to do is our procedure will be to isolate the staff so that they're providing care only to active COVID-19, and there is no crossover between non-active patients and active patients. So please don't be worried about that. We're doing everything we can to ensure that doesn't happen. We're obviously, like I said, with the PPE, doing everything we can to make sure that there's little chance of transmission between the clients and the clinicians. So hopefully that will make you feel a little bit better. Also, there's a couple things you can do to help prevent the spread of COVID-19. The first thing I think is, of course, there's a stay-at-home order right now, and I think that's probably the biggest thing to do with not getting COVID-19 is to stay home. So unless there's a medical emergency, I would advise that you stay home and limit any trips outside to those that are necessary. The other thing is limit the people coming into your home. So this may be the one time in your life where you need to prevent the grandkids from coming over, or the kids from coming to visit with you. Once again, there is the possibility that someone could have no signs or symptoms and yet have active COVID-19 and spread it. So, make sure that if someone's coming to visit you, that it's really necessary for them to come in. Might be wise to have them check their temperature. So if you're going to have someone come over, have them check their temperature before they come. And if they have a temperature north of 100, I would recommend you tell them to stay home as well. Hand washing is another great thing. So I know you see it on the news, and everybody's talking about proper hand hygiene and washing your hands. And we've all seen the videos where somebody will say, you need proper hand hygiene, and then they'll touch their face and do all these things that they shouldn't be doing. So once again, wash your hands. Keeping your hands clean is critical. And then if you do have people over, make sure you wipe down the areas with disinfectant, things they touch, just to be safe, right? You can't, in this scenario, there really is no way to go overboard because we want to ensure that you're safe and we don't have that worry. The other thing is, should you have your clinicians come and provide services? I know a lot of you think, well, by having them come in, you're put at higher risk. And I would suggest that we're doing everything we can to prevent that. And if you're not treating your primary illness, that the potential for you ending up needing medical care goes up, and we would hate for you to end up in the hospital. The worst place to be right now is the hospital or a clinic. So I think it's important that you allow the amazing care staff to come in, provide services for you in order to keep you safe and to keep your current long-term illness in check. And I think that's the best answer for you. So once again, I hope this helps reassure you that we are doing everything we can to help. We are dedicated to your well-being, your safety, and the good news is that I think we're looking to brighter days, and in a few weeks, hopefully, things will ease up and things will get a little bit better. But we're here for you. We're dedicated to you, and my promise is we'll do everything we can to keep you safe. Thanks so much.